Welcome to Copilot Podcasts. Your doctor just got a powerful new partner, and it's not human. Today, we're diving into how artificial intelligence is revolutionizing family and internal medicine. By the end of this episode, you'll understand how AI is transforming diagnosis, treatment, and patient monitoring, and why its adoption is more urgent than ever.
You know, it's fascinating how AI is already changing the game in healthcare. According to recent studies, AI systems can now detect certain conditions with accuracy rates over 90%.
Wait, over 90%? That's incredible! How exactly is AI achieving these results in everyday medical practice?
Well, let's take diagnostic imaging as an example. The latest research shows that AI tools are particularly effective in radiology and pathology, where they can spot patterns that might be invisible to the human eye.
Go on.
And it's not just about spotting things. AI is helping reduce the administrative burden on doctors. A recent survey found that doctors spend over half of their 11-hour workdays on electronic health record tasks.
That's a shocking amount of time on paperwork instead of patient care.
Exactly. And this is where AI is making a huge difference. For instance, new AI tools can now handle clinical documentation automatically, freeing up doctors to focus more on their patients.
I've heard about something called ambient notes. Can you tell us more about that?
Yes, according to recent surveys, ambient notes is the only AI use case with 100% adoption among surveyed health systems. It's basically AI that listens to doctor-patient conversations and automatically creates clinical notes.
That sounds like a game changer for doctors.
It really is. But you know what's even more exciting? The way AI is transforming remote patient monitoring.
Tell us more about that.
Well, imagine having a system that can predict an asthma attack before you even feel the first wheeze, or forecast diabetes years in advance through simple blood tests.
That sounds almost like science fiction.
But it's happening right now. Studies show that AI-powered remote monitoring systems can improve treatment outcomes by up to 30% compared to traditional approaches.
You know, this reminds me of how calculators changed mathematics. They didn't replace mathematicians, they enhanced their capabilities.
That's a perfect analogy. The American Medical Association actually prefers the term augmented intelligence over artificial intelligence for exactly this reason.
But what about the challenges? There must be some hurdles to implementing all this technology.
Absolutely. Recent surveys identified immature AI tools as the biggest barrier, cited by 77% of healthcare organizations. Financial concerns and regulatory uncertainty follow at 47% and 40% respectively.
Those are significant challenges.
They are, but the potential benefits are too significant to ignore. For instance, AI systems have shown they can predict heart attacks with up to 80% accuracy by analyzing electronic health records and genetic data.
That's remarkable. How are doctors responding to all this change?
According to the latest AMA survey, 68% of physicians now see advantages to using AI in their practice, up from 65% last year. And actual usage has jumped from 38% to 66% in just 1 year.
That's a pretty dramatic increase in adoption.
It is, and it reminds me of how electronic health records were initially met with resistance, but are now standard practice.
Interesting parallel. What about the impact on chronic disease management?
That's actually one of the most promising areas. AI is particularly effective in managing conditions like diabetes, heart disease, and respiratory conditions through continuous monitoring and early intervention.
Can you give us a specific example?
Sure. In diabetic care, AI algorithms can detect diabetic retinopathy from retinal images with over 90% accuracy, enabling early intervention before vision loss occurs.
That's incredible. It's like having a tireless assistant constantly watching for problems.
Exactly. And unlike humans, AI doesn't get tired or distracted. It maintains consistent performance 24/7.
But what about the human element of medicine? Isn't there a risk of losing that?
Actually, it's quite the opposite. By handling routine tasks and data analysis, AI frees up doctors to spend more quality time with their patients.
That makes sense. It's about enhancing rather than replacing human care.
Right. And studies show that AI-assisted healthcare can lead to better patient outcomes through more accurate diagnoses and personalized treatment plans.
Speaking of personalized treatment, how is AI changing that aspect of medicine?
Well, AI can analyze vast amounts of patient data, genetics, lifestyle factors, environmental conditions to create truly personalized treatment plans.
Go on.
For example, in oncology, AI-driven precision medicine has shown to improve treatment outcomes by up to 30% by customizing cancer treatments based on the genetic makeup of tumors.
That's a significant improvement.
And it's just the beginning. The technology is constantly improving and finding new applications.
What about smaller medical practices? Can they benefit from AI too?
Absolutely. Many AI tools are now being designed specifically for primary care and family medicine practices, helping with everything from scheduling to diagnosis.
But isn't implementing AI expensive?
While there are upfront costs, studies show that AI can actually lead to significant cost savings by preventing hospital readmissions and reducing emergency room visits through early detection.
That's an important point about the long-term benefits.
Yes, and it's crucial for practices to understand that delaying AI adoption might actually cost more in the long run.
How so?
Well, as AI becomes more integrated into healthcare, practices that don't adopt these technologies risk falling behind in both efficiency and quality of care.
That's a concerning thought.
It is, and it's why medical schools are now incorporating AI literacy into their curricula. The next generation of doctors needs to be prepared for this new reality.
What about privacy concerns? That must be a big issue.
Absolutely. Data security and privacy are among the top concerns cited by healthcare organizations when implementing AI systems.
How are they addressing these concerns?
Through robust data governance frameworks and strict compliance with healthcare privacy regulations. Many organizations are also working with specialized healthcare AI providers who understand these requirements.
That's reassuring.
And it's crucial for maintaining patient trust while advancing healthcare technology.
As we wrap up, what's your biggest takeaway about AI in medicine?
The key thing to understand is that AI isn't just another tech trend in healthcare, it's fundamentally transforming how we prevent, diagnose, and treat diseases.
And the urgency of adoption?
It's critical. The gap between early adopters and those who delay is widening, and that directly impacts patient care quality.
So what's your advice to healthcare providers who are still on the fence?
Start small, but start now. Begin with proven applications like clinical documentation or diagnostic support, and build from there.
That seems like a practical approach.
And remember, it's not about replacing doctors, it's about giving them better tools to provide the best possible care.
Just like that calculator analogy we discussed earlier.
Exactly. The future of medicine is human expertise enhanced by artificial intelligence, not replaced by it.
Well, that brings us to the end of today's episode of Copilot Podcasts. Remember, the AI revolution in medicine isn't coming, it's already here, and it's making healthcare better for everyone. Thanks for listening.